Yeah, a couple of comments there, good questions. First of all, I'm a complete pragmatist, and my job is hard enough, so I use any tool and not just medication that's available to me. I use any sneaky trick possible to get people better, with, of course, their full informed consent. Because, you know, it's not just medication. There's also a lot of good stuff with meditation, Tai Chi, eating properly, vitamin D, season effective lights, the whole bit. The other point that you reached on there was the fear surrounding suicide. So if we look at a lifetime prevalence of suicide in untreated, non-treated depression, okay, the suicide rate approaches 50%. So half of them are going to be gone, okay? Now, if we treat it, and that includes medication and therapy, okay, or just one or just the other, the death rate from suicide probably drops to around 10%. So it's something that we can do an awful lot about. And part of that is getting people back to work. And one of the questions you were brought up was, you know, the whole notion about safety concerns and that. That, you know, everybody looks at the media and they think about people, you know, shooting up coworkers and stuff like that. And I mean, okay, it makes great media headlines, but I'd like you to think about how many people go to work every day and it doesn't happen, okay? So the experience really is that, you know, your coworker is not going to go, you know, crazy or woohoo. It's what is going to happen is that if he or she or they do not have the support of the workplace, that they're going to feel worse. And then things are going to spiral down, and then I get more work. I like to reduce my workload, not increase it. And if people support one another in the workplace, like you were saying, you know, touch base with one another. I've got great places that really try and look out for me, and for that I'm super grateful. And we look out for one another because no matter where you work, there's challenges, there's stressors, there's stuff, you know, that gets to you. And if we're there for one another, we can make it a heck of a lot better place for everybody.
And I think too, I mean, you certainly made some legitimate points about, you know, stigmatizing somebody further, and I think it is sometimes a tricky balance from our perspective. You know, when we're working to get somebody back to work, is, like I said, deconstructing that barrier, because if somebody's coming back to their workplace and like, yeah, you know what, she's crazy, she had a nervous breakdown, she yelled at everybody, and you know what, we're just not having it anymore, and there's not an openness to recognize that they're feeling better, what happens is that they're then isolated, and then they feel worse, their symptoms may increase, and then all of a sudden we have a self-fulfilling prophecy where that exclusion, that stigma, that isolation does create potentially more illness in somebody that was already suffering. So it is very important to have that balance. And you know, we do try to encourage employers to think a little bit about, you know, it's not, like you said, getting the, you know, astronaut standard back to work. It's about thinking about what kinds of things do we need to enable in our workplace. If, you know, it's going to make all the difference in the world to allow this person to work slightly different hours, or to take a longer exercise break in the afternoon for their mental and physical health. If it's a matter of, you know, lots of different things, pet therapies you see in different workplaces, all kinds of things. It's a matter of saying, okay, let's toss aside some of that stuff that we used to, you know, think about our workplaces that you had to fit within a certain box, and start thinking about, you know, how to get past some of those barriers and say, okay, you know, it makes me feel better if I can, you know, kiss a baby every now and again. Like, how do we, you know, get some of those feel-good things back into the workplace, and to help people regain their health. And, you know, we have to start thinking better about it.
I entirely agree with that. And one example that we could use for what we've done in the workplace, you know, in, I don't know, in the past 30 years, is the notion of people with mobility needs, right? And so now you see places where you've got power doors, right? And you've got a standard that a public building has to have. You do things like putting a ramp into a place as opposed to the person having to drag themselves up on their bum up the stairs, right? So it's like we don't even think about that anymore. And yet, in my life, okay, the schools didn't have ramps when I started going to school. We didn't have any of that. We didn't have wheelchair accessible washrooms or anything, right? And that's changed in a relatively short period of time, I'd like to think. And so why don't we do that same kind of thing for mental health problems, right? So puppy therapy, whatever, right? Why don't we, you know, be there for one another, and just by the act of kindness, we can do an awful lot. And again, and relating and giving the feedback to the employers to say, hey, guys, you know, your rate of claims here for mental health problems is sky high compared to every other department or every other big employer that we know here. What's going on, right? Without it being a witch hunt, just saying what are the factors here that are causing this place to be so full of stress that so many people are off on sick leave. Yes, sir.
What about the barrier that some people with mental illness face where their employer or co-employees don't believe that they have a problem because mental illness is an invisible illness? You can see someone with a broken leg, you can't see someone with depression, anxiety, whatever.
Yeah, and that's education. Like, honest to gosh, I run into that every week, at least once or twice, easy. Some weeks it seems like every appointment's like that. And you know, like you said, if it's a broken leg or an amputated leg, it's like it's pretty obvious where the problem is, right? You know, what I counter it with is that we've got all these different illnesses or diseases in our bodies. You know, we've got problems with our heart, we've got the diabetes thing, we've got, you know, lung problems, asthma, that kind of stuff. We've got arthritises, right? Like everything can possibly go wrong. So what is it that's so special above the neck here that nothing can go wrong up there? Like, excuse me, you know, things do go wrong, right? And then if we give the person the benefit of the doubt and try and work with them, show them some random act of kindness and support, the vast majority of these people, I think, can get back to work. And certainly it would be a more humane thing. We'd have more productivity, I think, in the workplace. I know some workplaces where you had a person that was, you know, had quite a visible kind of disability, and because that person was there doing their thing at work, it made the place a little bit lighter. It was a lot more fun when this one person would come around going through the office. And, you know, we could do this, you know, and I think it boils down to a stigma. It boils down to education and having a bit of an open mind. The vast majority of people who are off on mental health claim are not faking it, okay? For example, you know, you get back claims or this kind of pain claim or a mood claim, right? About 95 to 98% of those claims are relatively legitimate. Some of the symptoms might be amplified a little bit, but most of them are pretty darn reasonable with telling you what's going on inside them. And there are some people that are scamming it, but they are by far the minority. And if we keep that in mind and kind of, you know, accept the person for who they are, and not be scared of them, and educate yourself about, you know, depression, about anxiety. Those are the two probably most common things, that and substance abuse. That'll go a long way towards changing societal attitudes.
Excuse me. It's another factor that I found very helpful when Steve stood up there and he shared his story too. I find that very helpful when you see champions out there who have been through mental health leaves. I was off work for 3 months. I was accommodated into another position at one point, and being able to go out and tell my story and share the success of addressing some of the mental health stuff I had going on, I was only able to do that because I had others before me who shared their stories, who were walking the walk and able to confront what they were going through and see signs and symptoms in themselves, which prompted the vicarious trauma compassion fatigue workshop that Francois set up to assist people in recognizing what their signs and symptoms were so that they could catch it early enough to start making those changes before things seemed to spiral out of control. So I thank the champions for people coming up and sharing their stories and being an example to other people in the workplace to be open to share their stories, to live their experience, and to not keep hiding and delving in darker into those, the substance use and insomnia and never addressing and dealing with their problems, or they end up isolating themselves from dealing with problems, and then it gets out of hand. So yeah, thank you everybody who can share and walk the walk.
Did folks have any questions? I could talk about this all day, but you don't want to listen to me. Yes?
Earlier you spoke of mental health costing the workplace, I think you said 20 billion would be, well, that's a started number. Surely that would attract attention of bean counters and directors. When you talk about the biggest remedy being education and programming, are management on board with making the change, or are you finding resistance?
Depends on the workplace. Certainly the attitude at National Defense has changed, okay? And there's a lot more recognition of the impact of not just deployments, but even just training, and how it impacts upon the people in uniform. And there's a lot more talk about it. Compare that to 20 years ago, okay? We still had people going away and doing UN missions and observer missions in Africa. And amongst that group, okay, there was way too many of them that killed themselves over the years, and way too many of them that I treated for alcohol problems. And we didn't talk about it at all. Now, you hear the Minister of National Defense or Minister of Veterans Affairs talking about it. So at the federal government level, it's definitely changing. The $20 billion is probably an underestimate. Each week, 500,000 Canadians will not be at work because of a mental health or substance use problem. Okay? 500,000 each week. That's the magnitude of it. And the employers have either, and that's where, I talk about the suicide rate going up in Alberta, and, some employers will just go, woohoo, whatever, they're weak sisters, whatever. But when you start talking money, okay, that's when the employers start going, oh, geez, I could save on my insurance costs, right? I could improve profitability. Then they start becoming more humane, right? And yeah, that figure is not made out of thin air. It's real, and I think it's an underestimate. The employers that get that are going to have a competitive advantage, and they're going to do better, and they're going to have better people, happier people working there, and people want to work there. And it's not just about how many dollars an hour that you pay, it's also about the place that you work. And so they should get that, and I hope they will. And the message is spreading, but keep repeating it. And if each one of you tells 1 or 2 or 3 friends, by the time the end of the week comes around, this kind of information will be out there in Whitehorse, because the Jungle Telegraph works really quickly here.
I'm born and raised Yukon, and I'm just very concerned about my community because We have an incredible high rate of alcohol and drug consumption in the Yukon. And there are a lot of mental health issues. We don't have a lot of aftercare. In fact, there are enough clinical reports out there that demonstrate that we have sketchy aftercare in Whitehorse and almost nothing in the communities. And we have even those folks that are in the communities, like in the nursing stations, that are working by themselves, which technically I thought was not allowed under workers' compensation, but dealing in high-stress situations. And it seems like if I'm talking to the elders, they say to me, the number one problem in the Yukon is alcohol, which of course is related to mental health, etc. So if you were to prioritize, if you were like emperor for the day and change the mental health piece or the Department of Health, what would your sort of first, top 3 priorities be as far as, where would you put the support?
So one of the things that we're already doing, and I spoke at the Yukon Medical Association about this, was screening for problematic alcohol use, okay? So the binge drinking on Friday night, as opposed to having 15 beer, maybe you should only have 8 or some smaller number, right? And stuff like that, and getting in there before the full-blown illness of alcoholism arises. There's some very interesting studies, Canadian, right now that are being done. It was done both in a primarily Caucasian population and also in a First Nations one that intervened in the school at about age 8, 9, 10 years of age, before we start getting into cigarettes, alcohol, etc. This intervention does seem to work, and this is something that is being floated around in ADS right now, where I work, and to try and get this prevention message happening out there sooner. And if we do that, we can definitely decrease rates. Now, our rate, we're no longer number 1 in the country, we're now number 2. Okay, Northwest Territories passed us, so yay. Not an enviable position to be, but yeah, no, I think booze is the number 1 problem up here, and it's something I'm really working hard at with my colleagues at ADS. And the difficulty is measuring rates. Okay, so everybody in the community knows that it's a problem. Everybody talks about it, right? But when the government comes to saying, well, if we're going to fund this much, give us some real numbers here, right? And we don't have numbers, are you ready for this, that are worth much of anything amongst First Nations people. And yet we know it's a huge problem, okay? And the studies are finally coming out. So Dr. Brendan Hanley is the medical officer of health. There's going to be one coming out within the next year that will really help address that. And then the funding should flow to that. But again, there's a stigma, right? So it's a person who's just a drunk, okay? And so we don't want to address that kind of issue. Well, guess what? It's a chronic mental health problem, okay? It's not about lack of willpower. It's something that we can measure in certain people's DNA and their receptors, that they have a problem with alcohol. And growing up in a traumatizing environment, yada, yada, yada. I could go on all day on this, but we can intervene early and cheaply and save the government money, and that the research on that is clear, and we're trying to move in that direction. Do we need more treatment resources? Absolutely. We have placed some more people out into the community. I know of at least one in Haines Junction now that we didn't have before. Do we need more mental health nurses out in the community? Yep. And I've been talking about that with the government for a while. I'm seeing some good things happening, and yet there's a large need still.
I also think there needs to be a lot of training for people at ADS to deal with First Nations people. I was born and raised here, and as you know, I'm First Nations, and I do face a lot of those stereotypes that you speak of. And it stemmed more from just alcoholism and living in a traumatized, growing up in a traumatized home. And I feel that a lot of the workers in ADS and health and social services and justice don't quite get it. And a lot of them are not, from my own experience, don't want to know because they have their own problems. So to me, there needs to be a screening of people who go into those jobs. Are they racist? Are they able to, recognize trauma in children and work with them in a way that they're not re-traumatizing them again? I've had family members in and out of group homes, and they come out worse because of the weak people who take care of them in the group homes. That's just my thing. That's my favorite thing.
I would agree with that. We're trying to learn, okay? And I sense at ADS anyway, amongst a lot of the counselors there, that we're trying to make ourselves more informed about it, not just, the mandated treatment or mandated course on cultural sensitivity. It's also sharing stories with people and finding out the stories of the different communities in that. And I think it's part of this whole truth and reconciliation process that it's not just you and me, it's us as a society we have to go through because we're all here, we're all Canadians, and we need to be there for one another and to help one another because this country is not the place south of the border. No disrespect to Americans, but I like to think that we can be at a higher standard. And I've got lots still to learn, and I love being taught. So, and stuff that we can do. What we've done at ADS in the last 2 years is really revamp a lot of the trauma stuff, and also revamp a lot of the screening for fetal alcohol and alcohol-related neurological deficits, and also with informing ourselves as to more of a First Nations sensitive environment. I've been on smudges at some of the treatment inpatient programs, and I've found them very helpful for me and for my demons. So, what the heck, we can learn from one another. So, yes, sir.
You stated that in conversation with government about more mental health, nursing in communities. Speaking from experience, know that in communities that type of service is either very slim or non-existent or a very, very high rate of turnover. How is that conversation going?
Slowly.
Slowly?
Yeah, I wish it was quicker. I got a real problem with the length of time that it takes to recruit a person. And then I got a real problem with the length of time that it takes to get a contract in that person's hand. If you've got a good, reasonable candidate, okay, that person should get, here's the letter, here's the job offer, here's the contract, and we want you here 30 days from now. 6 months, what would you do, right? Like if we'll give you a job here, but we're anticipating getting your payroll started in 6 months' time. What are you going to do? You're going to be gone, right? You're going to find something else. So we need to get better at that. And I think that there is a recognition in certain people in government about that. I just don't know where the process on that is yet. But I am pushing for that because I see that as a huge problem. And it's something that we need to really tackle aggressively. Yes, sir.
How many workplaces, are there where there's meaningful intervention options available? I haven't been in one in Yukon, and it might be a minority. What about non-unionized Walmart workers? What would be the situation there? I mean, some time ago, there was a big grassroots fight here to stop Walmart from coming here. And, union voices were not very prevalent there. Those would be the kind of situations where it would be nice to hear from unions what kind of mental, psychological, I don't like the word mental health, but what kind of psychological problems it throws on people to sort of bring this kind of union busting here. I mean, it would be good in the future. Connecting dots makes often issues stronger, to hear more from unions when it comes to, union busting.
I don't shop at Walmart.
Yeah, well, I mean, I'm not saying, I wasn't asking, for purism in any form, but we had a meaningful fight here on our hands when we tried to stop that.
I believe it.
Folks, if sort of coming up to 1 o'clock, and I know Dr. Elwell has patients to see and places to be, so I would just, on behalf of the UConn Employees Union, like to thank Dr. Elwell and Lisa Vollans-Leduc for taking time today to talk about this important topic. Oh, and tomorrow's. So the Human Rights Speaker Series is continuing for the rest of the week. There is a brochure, that little black and blue one just beside the door, but tomorrow's session is titled Be a Catalyst for Change, and it will be hosted by the Yukon Circle of Change, including Christine Clausen St. Pierre as one of the speakers. So hopefully you'll come back and have lunch with us again tomorrow and the next day and the day after that to hear about other topics as well. So thank you again for coming, folks. We really appreciate it. Okay.
And it's all about what compassion, creating Good.